Good day. Thank you so much for tuning in. Dr. Kende Elisha speaking here. So what does it take to get into CRNA school? You have to write this essay, the best essay in the world. You have to pass your CCRN. You must have worked ICU for at least a year, preferably maybe 2 years. Your GPA must be top notch, okay? In addition, you must have a lot of money to put aside so that when you get to CRNA school, you won't be so broke because you're going to go on for some time without working, right? So in addition, if you have kids, and a family to worry about, that is also part of the things you have to plan for. So now you got in, you made it in, and now you want to quit. No, this is not the time to quit. We're gonna get you through that CRNA school, all right? We will get you through that CRNA school, guaranteed. So what does it take to really get through? Well, the formula is very easy. Repetition, repetition, repetition of the right content. That is all it takes. And having the right teacher to guide you through and hold your hand until you take your board prep, or at least until you get through school first. That's the first phase. Get through school first, and then we can worry about the board prep later. Okay, in addition to all of that, we want you to hit the subscribe button. We're going to give you a little bit of example of how we're going to be presenting our courses and what it takes. They are just basic concepts. I went through that course too. Basics of anesthesia, pharmacology of anesthesia, physics of anesthesia, chemistry of anesthesia. I will be teaching you the things that I learned and see if you can learn something from me also. All right, let's get started. So we're here. Anesthesia Fast Facts for CRNAs by Dr. Kehinde Elisha. Again, visit us www.npcertificationacademy.com to find out more. You can also email nurse-to-nursecoach@gmail.com if you have any questions. And feel free to also text, preferably 347-901-6037, or you can also call the same number. What is anesthesia then? Anesthesia is a medical specialty that involves use of medications and techniques to induce a temporary loss of sensation, consciousness, or both during medical procedures. Now, what exactly is the purpose then? We want to prevent pain during surgery or other invasive procedures, to allow for safe or comfortable surgery by providing muscle relaxation and unconsciousness, to monitor and control vital signs during procedures. So what are the types of anesthesia? I kind of like water this down completely. It's deliberate just to help with our retention. I brought in some simple explanation and mnemonic to remember it. General anesthesia, local anesthesia, MAC. General, regional, local, and MAC. General, regional, local, and MAC. So keep that in mind, okay? So general is what? It makes you totally asleep. These are the big surgeries. That's when we use it for. We don't want you to be aware or to wake up in the middle of it. There are major things like for abdominal surgery, heart surgeries, right? And some of the basic other big surgeries. What about regional? This one numbs a bigger area like the legs, like the arms. For example, if you want to have a baby, they do epidurals. If you want to have leg surgery, they just numb that area. So the particular region that we need is what we're going to numb. That makes it regional. What about local anesthesia? It numbs a little tiny area, like a small cut. For example, when you go to the dentist, they numb your little mouth. They don't numb the entire body, right? Just because that's where they want to work on. That local area that they want to work on, that's where they're going to numb. Or if you have a cut and they have to put a little stitch on you, they do local anesthesia. All right, what about MAC? Light sedation with local numbing. You can breathe yourself. So you are a little bit out and you're a little bit sedated, but you're still there, right? It's just for minor procedures, right? You're still there. You can breathe yourself. You don't have any ventilator being used. So it is different. So now we have general, regional, local, and MAC. MAC is extremely common, okay? And of course, general is common too, depending on what procedure we're having done, okay? Now, let's look at a sample question that you're likely gonna get when it comes to this, to the types of anesthesia. Let's take a case. And how should you be reading questions on tests? How should you be, breaking down your case? Let's look at some keywords here. A 72-year-old is a keyword. 72-year-old woman with hypertension. Osteoarthritis is scheduled for elective right knee replacement. 72-year-old is a keyword. Woman is a keyword. Hypertension is a keyword. Osteoarthritis is a keyword. Now scheduled for what? This particular procedure is a keyword because you have to know what procedure that we're talking about. Now, she is nervous about general anesthesia due to a previous history of post-operative nausea, and vomiting, which is very, very common with our general anesthesia. Now, the anesthesia provider discusses alternative options with her. So this is now the real question. Now, exam will not separate for you what the question is and what is not. You have to ask yourself, what exactly are they asking me? Which one really is the question here? And you can do that by detaching the question from the case scenario by saying, okay, this is exactly what they're asking. The case scenario is also important because it's going to help you navigate what they're asking you anyway, but you still have to know what they're asking you. So the question states, which type of anesthesia would most likely be appropriate for this patient, considering her age, surgical site, and the desire to avoid general anesthesia? A, local anesthesia. B, regional anesthesia. C, general anesthesia. D, monitored anesthesia care, which is the MAC. Please drop your answer in the chat. Thank you so much for dropping your answer. We know the final answer here is B, regional anesthesia. You know it's not local. Local is not enough for this procedure that we're about to do. General will knock the patient out, probably give the effects that the patient is running from to start with. And of course, we know that MAC, that is monitored anesthesia care, that is MAC, right? And that one is just, for procedures like colonoscopy. Again, the best answer again is regional anesthesia. This method provides anesthesia to lower half of the body. It is commonly used in orthopedic procedures like knee replacements, especially in elderly patients. It avoids the side effects of general anesthesia such as nausea and vomiting, and it is very effective for pain control. So why is local anesthesia incorrect? Like I said, it's only going to numb a small area. It is so not sufficient for the procedure that we're about to do in this case. General anesthesia, on the other hand, for an elderly patient, it's gonna create some more complications and like nausea and vomiting that we're running away from, right? So it's not the best first line option for surgery unless we need it. That's when we go for it. Then the MAC, monitored anesthesia care, that involves sedation and monitoring, often used to monitor procedures like colonoscopy or minor skin surgery. It does not provide sufficient anesthesia for major orthopedic surgery. Now, what are the phases of general anesthesia? Phases include what? Induction, maintenance, emergence. Induction, maintenance, emergence. Now, let's go ahead and discuss it in a layman's term. Induction, you go from wake to sleep. You go from awake to sleep. Induction, to induce sleep, right? Think about it that way. Maintenance, you stay awake while surgery happens. I want to maintain your sleep. I want to make sure you are awake while surgery happens. Emergence, you wake up after surgery. Emergence, you wake up after surgery. In a way, if you think about it, sometimes when you wake up, you create some kind of emergency, if you think about it, because you're waking up to the unknown. You don't know what's going on. You just wake up and see all these blue and white shirts, and you see all this equipment around you in a small little room. You have no idea where you are, how you got there. You lose that for a moment. So you will start acting like, oh, there's an emergency here. So hopefully that will help you remember emergence. You wake up after surgery. So what is the mnemonic to remember this? In my eyes is equal to induction to maintenance to emergence is IME. IME, you go from wake to sleep. You stay asleep, and then you wake after surgery. Me. All right? I hope that will help you remember the order of things. So we're going to go ahead and end the presentation right here. And the next video is going to talk about common anesthesia medications. We're going to be talking about drugs, side effects, drug-drug interaction, food-drug interaction, drug-disease interaction, something that you also need to watch out for on the exam, something that will definitely happen that can put your patient at risk. We're going to be going over that. So we look forward to seeing you again in the next video. Thank you.